Dr. Olorinimbe Mamora. Dr. Mamora, thank you for joining us on the News at 10.
Thank you very much for inviting me.
How has it been this 100 days?
Well, it's been 100 days of mixed bags, if you like, because COVID-19 has affected us in several ways, affecting our social life, the cultural life, the religious life, economic life. So, and in all this, you see, there's a way that whatever that appears bad may also have some good embedded in it. If you look at our health system, COVID-19 has exposed the weakness in the healthcare system of our country. But that in itself is an opportunity for us to see and recognize this weakness in the system and, of course, put measures in place to rectify and correct this. So, in a way, it's sad that we've lost some people. It's sad because it's put a lot of strain on our health system. It's sad because the things we used to do, they're no longer the same. But then, in all this, it has also given us an opportunity to rejig the system one way or the other.
And of course, the thought is for us to come out of this whole and much better than we started. But we went from one case on February 27th to over 12,000 today, out of which about 4,000 have recovered, and we have over 300 deaths. Testing has been a key issue during this whole period of study. In your view, has that improved over time?
Yes. You see, we are still, we are yet to reach our peak. So people are still testing. And testing is an integral part, a very key component of the response activities. Because until and unless you test someone, you cannot determine if that person is positive or negative. And of course, that's why all along the efforts have been, and alongside others, the need to put in place isolation and treatment centers. And the whole essence of getting people tested is to know who to isolate. And when you isolate, you limit or reduce, if not totally eliminate, the possibility of transmission of infection. And in so doing, we have created over 5,000 isolation and treatment centers. And of course, we have also increased the testing capacity from an initial number of about 4 molecular testing laboratories. As of today, we have 30 molecular testing laboratories where people can get tested and the status confirmed and determine what to do by way of isolation and treatment. So we continue to do that, and of course, it's an opportunity to increase the service in our hospitals, both at the tertiary centers, that is the teaching and federal medical centers, and of course in the states all over the country. We have been able to set up emergency operation centers in all the 36 states and the Federal Capital Territory that, in conjunction, with the Nigeria Center for Disease Control, these are centers that have been able to have one national response to our public health situation in the moment, in the country as at this point in time, with particular reference to COVID-19.
Great, and I want to pick up on something you said, that this pandemic has exposed our health system. It exposed the health system of even the most developed countries in the world. But right now, we need a plan for the next 3 years. Do you have one?
Yes, yes, I did say it as a exposed weakness in our health system. But like you rightly said, it's all over the world. No country was ready for this. No country was prepared for this. And even the hitherto thought countries that had very good and strong health systems, they collapsed under the weight of COVID-19. So in our own situation, what we are doing, particularly at the level of the PTF, and of course in conjunction with our donors that have helped a lot, the COVID, the oil and gas industries, of course the UN systems in Nigeria, the European Union, the WHO, the Africa Center for Disease Control, the West African Health Organization, all these people who have supported us. Now, what we are trying to do in our own situation is to ensure that with this experience, we can have at least 100-bed infectious disease hospital in every state and in the Federal Capital Territory, with each of these having not less than 30 intensive care beds in each of these, so that next time around, if and when we have this kind of situation, we always have infectious disease hospitals in place. Because you probably have just a few hospitals right now, a few states, to say, in Nigeria that have infectious disease hospital that is set aside for that purpose, so that when you have a situation like this, you know that you don't have to start running around. This will already be in place, of course, with the attendant services and the capacity in terms of health workers, the doctors, the nurses, the laboratory scientists, and all the components that you need to make such a hospital function.
Indeed, and I thought we had learned a lot from the Ebola crisis, but thanks again for joining us. Good to know you do have a plan. Thank you again, Dr. Lauren Imbe Mamora, for joining us on the News at 10.